to me, and I'm breaking it down, and I'm thinking, wait a minute. Now,
Yeah.
why would, let me see, what would conservatives have a problem with? Well, they can't say it's new taxes, no.
Right.
They can't say it adds to the deficit because you're using some of the money to pay it down on the deficit.
Yeah.
I mean, and the money is sitting in an account somewhere. I mean,
Yes.
it's a win-win situation.
Absolutely.
Thanks for your call. Liddell
Have a great one.
From Michigan is a first-time caller. Go ahead.
Yes, hi, Joe. My name is Liddell Harris, and I'm actually 25. I'm actually in favor of healthcare reform. I'm a healthcare broker, and I really think that people have a miseducation of what's going on with healthcare.
Do me a favor.
Yes.
Yeah, educate us. Take your time. How old are you?
I'm 25.
Explain to your peers why they need health insurance.
Well, you need it. You know, just like of what you were touching on a second ago when you pretty much were explaining the point, what happens when you get hurt. I mean, I was playing basketball, for instance, myself. And, you know, I didn't stretch. I got out there, I started playing basketball, and, you know, all of a sudden, you know, something happened with my knee, and I'm thinking it's okay. You know, I step outside and I walk it off, but I end up tearing my ACL. Now, we all have the common misconception that we don't worry about the cost of health care. We'll just go to the emergency room. You go to the emergency room, as soon as you walk through those doors, that's money. If you take an ambulance, that's money. If you get any type of medication, that's money. You spend the night in the hospital, that's money. All of these things are called essential health benefits, and they're built into the actual bill.
We had a ER doctor call us, and he said, when you walk into that hospital emergency room and look at my name tag, it will cost you $800.
Exactly.
He said it will cost you $800 just for me to look at you. Now, if you're 25 years old, 26, 27, 28, 29, 30, and you got $800 lying around, then fine. You know, more power to you. Then you don't need affordable health care.
Right, and something else to kind of touch on, the study and the statistics, I think there's a lot to really draw from that, because that could just be individuals that's just reading that. I mean, I'm a first-time caller. My dad's been encouraging me, like, you know, you gotta call in because this is what you do. You should listen to this. And really, I think people need to know it's just the education.
Right.
I think those figures are so far off because, you know, you're not in the community and seeing actually what help people are actually kind of getting. You know, I enrolled somebody the other day, and, you know, that cat, you know, all of those high costs and everything from those 57 plans, they end up paying, they got a plan that's like 44 cents. So I'm asking, explain that to me.
Yeah, where is that letter? This story. Well, where is the story? I think I still have time. Lady said she was just, tears were flowing, where she said she never could afford health insurance. She went on one of those plans, and she now can get health insurance for $3.19.
Exactly.
$3.19. And this is, by the way, minimum standard, but it's based on her ability to pay. Based on her ability to pay. Here it is. There's the story. What Republicans don't want. Florida woman cries tears of joy. Joanne Smith, 60 years old, is making headlines as the latest Obamacare success story. She told NBC News that she just instantly burst into tears when she was able yesterday to sign up for a $3.19 a month health insurance policy through Obamacare. Smith described the low cost of her federally subsidized plan as totally mind-blowing.
Thank you so much for tuning in to this conversation. Part 2 will be available shortly. In the meantime, however, jump over to reform.quickquote.com. I've actually embedded the link in this video description. Go over there and actually ask your healthcare questions. You know, what you like about it, what you don't like about it, what your concerns are, and you can actually search different healthcare questions on there too. Also, like us on Facebook. That's QUICQUOTE on Facebook. And I just really look forward to talking to everyone sooner than later. Take it easy.